Welcome. I'm John Clymer, Executive Director of the National Forum for Heart Disease and Stroke Prevention. Welcome to today's briefing on the critical role of community health workers in team-based care. This event is brought to you by the National Forum's Value and Access collaboration and made possible by support from Ardelyx, BMS Pfizer Alliance, Novartis, and Regeneron. Value and Access collaborative briefings aim to present multiple perspectives without bias on timely, controversial policy issues. We are pleased to have Dr. Taylon Taylor-Clark as moderator for this event. Dr. Taylor-Clark is Vice President and Head of Social Impact and Sustainability at Merck. She oversees sustainability, global impact investing and giving, and mission-aligned initiatives. Her portfolio includes all global product donations, including the Mectizan Donation Program and the U.S. Patient Assistance Program, Merck for Mothers, employee giving and volunteering, the Merck Foundation, and the Merck Venture Impact Fund. Dr. Taylon Taylor-Clark holds degrees from Tufts University and Harvard University and teaches at Johns Hopkins University's Carey Business School. Welcome, Dr. Taylor-Clark.
Well, thank you so much, John, and thank you everyone for being here. We're so thrilled that you could join us today. I wanted to just start by introducing the topic today on community health workers, or CHWs, who are really the backbone of community-based care, serving as trusted advocates who bridge the gap between healthcare systems and the communities they serve. Whether addressing chronic disease management, social drivers of health, or navigating complex care systems, CHWs play a vital role in improving health outcomes, particularly for underserved populations. Yet, despite this proven impact, CHWs often face systemic challenges that hinder their effectiveness and sustainability. Workforce development remains a pressing issue. Ensuring adequate training, career pathways, and professional recognition for CHWs is essential to expanding their reach and impact. At the same time, sustainable reimbursement remains a critical barrier. Many CHW programs rely on short-term grants or inconsistent funding streams, making it difficult to scale and integrate these essential roles into healthcare systems in a lasting way. Today, our discussion will dive into these challenges and explore solutions. We'll hear from experts and practitioners on what's working, what needs to change, and how we can ensure CHWs receive the support, recognition, and financial backing needed to continue their invaluable work. We have a great panel here to share their expertise, and it is my pleasure now to introduce our speakers. First, we have Mr. Alton Boulware. Alton Boulware is a community health worker with Impact Care, a former combat medic and second lieutenant in the U.S. Army. He brings his frontline experience in healthcare and service to his role, supporting community-driven health initiatives and patient advocacy. Next, we have Dr. Sigrid Burris. Dr. Sigrid Burris is a trauma surgeon at the University of California, Irvine, dedicated to reducing injury and trauma recidivism. She established and directs the hospital-based violence intervention program at Loma Linda University and works closely with organizations such as the American College of Surgeons and the California Medical Association to address healthcare disparities. Next, we have Ms. Janae Tyus. Janae Tyus, MPH, is the head of community mobilization at Impact Care, where she leads efforts to strengthen and expand the role of community health workers in advancing health equity. With leadership experience at the Michigan Community Health Workers Alliance and the Greater Flint Health Coalition, she is committed to empowering underserved communities through CHW programs, education, and policy. Next, we have Mr. Alex Fajardo. Alex Fajardo is the executive director of El Sol Neighborhood Educational Center, where he leads efforts to support and empower community health workers in advancing health equity. His work focuses on community engagement and culturally responsive care. And finally, we have Dr. Juan Carlos Belliard. Dr. Juan Carlos Belliard is Assistant Vice President for Community Partnerships and a Professor of Global Health at Loma Linda University. He specializes in medical pluralism, health disparities, and service learning, strengthening university community collaborations, again, to advance health equity. I'm grateful that you all are here, and welcome. So before we dive into today's discussion, we'd actually love to get a sense from our audience about the familiarity you have with community health workers. So we're going to be putting up a quick poll, which should now be visible on your screen. And the question asks, how would you rate your understanding of the role and impact of community health workers? Please just take a moment to respond. It'll help us tailor the conversation to the knowledge and interests of those joining us today. And while you're completing the poll, I just wanted to go through a few housekeeping notes. You can utilize the Q&A feature on Zoom to pose questions, and I will present them to the appropriate panelist for a response. Audience members can upvote questions that seem especially interesting, and those questions will arise to the top and help ensure that they're noticed. We encourage listeners to use the chat function to share your perspectives and to react to the program, but to reserve the Q&A feature solely for questions. All right, let's take a few minutes and look at our poll responses. And I have to apologize, everyone. I have been suffering from the flu, as I'm sure many of you have, so I'm a little stuffy today, but we're going to make it work. All right, so we have some strong response. So many folks are strong or experts. 55% of you are either have strong knowledge or expert knowledge of community health workers, which is wonderful. Where about 40% of you are saying you have basic or moderate knowledge, and about 5% have limited. So we have a round of various folks with various knowledge bases here. So that's wonderful, and it will be really helpful for us as we get started. So let us just go ahead and jump right in. I wanted to first ask Alton, since you're right here in my screen here, Alton, what makes CHWs so effective in their communities, and how do we ensure their voices are heard in healthcare decision-making?
Thank you, Dr. Clark. The effectiveness of community health workers really deal with our ability to be able to empower folks. It's giving them the reassurance, and not even that, setting out a roadmap towards a path of success for them, be it through the healthcare system, but also with managing life. When we look at the social determinants of health, there are just so many different factors that impact them, dealing with social emotional issues to dealing with food insecurities. And these issues are really threatening in a lot of ways. And so being able to empower them to focus, to regain a sense of confidence and knowledge, to be able to go forward, that is what really helps them out. I think that in terms of for the community health worker themselves, creating a pathway as far as growth opportunities, being able to push things through the state, through policy. These things are where it is that for myself, I can speak for myself, where I think that where we would want to head towards, outside of just dealing with our own personal and issues, just being able to go on to that next level, so that way we really can see sustainable changes within the communities that we're working with.
That's
Dr.
great.
Taylor
Thank
Clark,
you.
if I can come up behind him and just big up Alton and community health workers at large. I think what he's describing is, number one, effective community health workers are authentic. They are trustworthy individuals that are they come with lived experience, and they also come with an approach that is person-centered, as he described. They empower, they coach, they meet people where they are, and they get to know the root of people, not just seeking to check boxes. And so I think that's what also makes them effective. Their authenticity, their person-centered approach, and their just real empathetic ability to just center the person in whatever they're trying to do. I think that makes them effective as well.
Thank you, Janae. One of the things you describe is this trustworthiness, and this is something that keeps being brought up over and over as we think about changes to the health system, needs for the health system, to really bring trustworthy actors to the table, to really help the most vulnerable of patients. So I really appreciate those words. Alex, I'd like to turn to you really quickly to ask about your perspective of what makes CHWs so effective in their communities and how we ensure their voices are heard in healthcare decision making.
Thank you. I think I would like to add. I think the strengths of the CHW really is because they build relationships. That sometimes is hard or is not easy for a medical professional that cannot replicate alone. I think that's the first role of the CHW, developing this strong relationship with them, and then also I think the CHWs address health in their community, and they go beyond or just medical care, which sometimes is hard. So I want to add those two line items too.
Yeah, and it's so very important as we think about whole person care. And this is something that has been brought up over and over as we think about how to change our health system from being a sick system to being a truly health system, is going above and beyond medical care, right? To be thinking beyond. And I think that was something that Alton also brought up, was this idea that we might even have to address food security and other types of social drivers of health. So very, very important to that topic. I wanted to turn to Juan Carlos really quickly to ask, so we know the value, right? We understand that there's a value of community health workers in building trust, in having meaningful relationships with patients and people that they serve in the communities, with really being able to go beyond medical care. But Juan Carlos, can you tell us a little bit about how do community health workers create impact beyond traditional healthcare settings? And what lessons can we learn from those successes? Can you share a little bit about your perspective there?
Yeah, absolutely. Healthcare is probably the newest member of integrating community health workers into the role. Community health workers and promotores really come from a community setting. So an example of another place, I always say that you can integrate community health workers anywhere where you have systems interacting with community, right? Because those are different cultures, they're different ways of doing work. So one example is what we have in partnership with Alex, is school-based community health workers. We call them CHWs, community health and education workers, that work with families who have chronically absent children in the school system. And of course, that addresses all the social drivers that impact healthcare, but in a K through 12 setting. And we found it to be very effective. And it's in partnership with a school district, with a community-based organization like El Sol, and with an academic institution like Loma Linda.
That's fabulous. Really thinking about that roundedness in terms of care in a community, going through the school as an opportunity. I think that's wonderful. Janae, did you want to add any thoughts on that question?
I sure can, but I think Sigrid came off mute. I want to give her space to share.
Good, very good.
Come at the end.
Sigrid.
Yeah, I just wanted to add, within the healthcare system, we all have such different objectives in mind. And as a trauma surgeon, as the nurse, or whoever it might be that's providing care, we have a very different focus that looks at, how do I control the bleeding? How do I get them up and walking again? Whereas the community health workers are able to take all of these healthcare needs that a patient has and think about the bigger picture of, what do we do when we're discharged? Is it a safe discharge back into the community? And how can we in the community support the patient so that we don't have another injury reoccur, right? Whether that's the environment that they had the trauma in, improving health literacy, looking at all of those support systems with job training, employment, that again, the community health workers can really take time and focus on that sometimes we in the traditional healthcare system aren't able to.
Mm-hmm. Really good point. Thank you, Sigrid. I'd like to turn now to strengthening the workforce, because I think that's really important both for the audience members that we have here, even though they might be very well aware of what community health workers can do. The question becomes, how do we actually really incorporate community health workers in terms of their professionalization? I know that when I've been working with the National Association of Community Health Workers and others, this question really came up as in terms of, do we get certification? Do we not go for certification? And how does that shift the authenticity of us as community health workers? So I'd love to hear from Janae. I'm actually going to call on you about how we balance the need for CHW professionalization through, say, certification and training, et cetera, with the risk of creating barriers to entry.
Yeah,
Can you
absolutely.
speak a little bit to that, please?
I'll try, Dr. Taylor Clark. So I think, historically, I come from the background. I used to be an executive director of the Michigan Community Health Worker Alliance, and we were the CHW certification and training provider. I think that's a great way to make sure community health workers who are authentic are sort of trained and have what they need to do their job well. But I think there's a little bit further that we can go, because when you sort of require that CHWs go through specific training or specific certification, it can create barriers to entry. Sometimes it's not cheap. Sometimes there are additional requirements that could push those that really are authentic, trustworthy, and worthy of the job out of it. What I think we need to shift to as we think about integrating community health workers into healthcare settings is make sure CHWs have environments in their created by their employer in order for them to thrive. So requirements that organizations hire authentic community health workers, that they cap caseloads, that they provide adequate supervision, that they provide career ladders and opportunities for CHWs to grow in. That goes beyond individual training and certification, and it pivots. It puts the onus on the employers to provide an environment for Alton to thrive. So I think that's a shift we need to make relatively soon, especially as we start to think about integrating community health workers in, because you can train people till they're blue in the face, but if you don't hire the right CHW that's authentic, you're not going to get the effectiveness nor the magic.
Yeah, no, this is a really good point, that a couple of the things you mentioned, and I'm just reiterating because I think it's important for folks to hear, capping their caseloads, having a career ladder, which is really important when you're bringing them in, making sure that they have proper oversight, because as you're bringing them in, they may want to be moving through the system, and putting more of the onus on the employers as opposed to the onus on the CHW themselves. So that's a really, really important point. Did anyone else want to address that question, how we balance need for professionalization? Please go ahead, Alex.
Yeah, I think it would be nice, or actually important, for CHWs should be incorporated into the healthcare teams without losing their autonomy. They should co-design the intervention with the other professionals, and they went both of them, the nurse or the doctor with the CHW, developing the clinical metrics, but also looking about community priorities, because sometimes get disconnected. Okay, this is just to improve clinical metrics, but sometimes we don't see the bigger picture, what is happening in the community. And then I think having that voice and creating the care plan together, I think is going to be really impact not just the clinic metrics, but really the life of the member. I just want to add that parallels.
And that's a really important point, really bringing the community priorities central to the needs of the people and patients they're saying they want to serve. So I guess the question becomes, as you're incorporating and bringing folks, CHWs, into, say, mainstream healthcare systems, do we think that there might be a risk of becoming too, quote unquote, medicalized in the process? Does anybody have a thought about that? Juan Carlos, you're smiling.
Yeah, I think that's one of the biggest challenges of integrating community health workers into healthcare. I mean, there's huge benefits from a workforce development perspective from what they can offer the healthcare system. But I think if we're not careful, the community health worker and promotor can be appropriated by the sick care system, right? And I think part of the solution is finding healthcare champions like Dr. Burris, who look upstream and look to community to really address the root causes. But also getting into the curriculum of medical students and social workers and nurses, so that they understand the true role of that community health worker in healthcare. But yeah, I think if we don't do this with care, the community health worker could be absorbed into the sick care role and just be another aid.
Mm-hmm, mm-hmm. Does anybody else want to speak to that a little bit?
Yeah, I'll tag on there. I think those are fantastic points. And as was put in the chat as well, we don't want our community health workers turning into case managers, right? Their focus is the individual, the family, the community, and how all of those interact together. And so what's going to happen once they leave the hospital and have left that healthcare system to go back to the community so that they can be healthy and thrive. And that's a very different role than a case manager, right? Who has very specific goals with safe discharge and kind of ends there. So although we need consistent training requirements and some knowledge of the healthcare system and what the patient's medical needs are, we have to keep in mind that there are many ways to address that. And it's really the role of the CHW in conjunction with the patient to figure out how to best get the patient healthy and living well.
Yeah,
I
absolutely.
love that. Can I just add a little bit? When you integrate community health workers, you cannot sort of segregate the word community from their role. I think that's the big thing. Like, this workforce has over 300 years experience being in the community. So when you bring them in, make sure you're bringing them in with the focus of keeping them focused on the community, that person's community around them. And I think ways that we can make sure they're not over medicalized is bringing a CHW to the table in the process of integrating, because they'll be able to speak to, no, I really should be able to go out and meet them where they are, or here's, another approach. And I think, Alton, maybe you want to speak to the level of ability that CHWs have to inform healthcare leaders about what CHWs really do and how important community is.
I think we're all talking about the same thing, but it's the key is trust, right? So the idea is that, coming into their communities and being a part of their community says that whole trust factor. If you're not really there, or you're looking out rather, you don't have those sorts of connections. And so what the CHW does is really bridge that gap and make it really succinct and straight to the point. But in addition to that, being able to allow them that access to tap into, hey, you have all of these different resources and support that's around you. And I think that ultimately eliminates that barrier and leads to more confidence. And as a community health worker also, it's interesting because you get to watch the process of behavioral change. The trans-theoretical model talks about going from a contemplation state to an action state to a maintenance state. And so you really get to see that step by step, just upfront and personal, in addition to the fact that they begin to build trust with their healthcare system, which is ultimately what we would like to see.
Yep, absolutely. Thank you, Alton, for that. So let's turn, I see a couple of questions around the risk. We've gotten to the risk of medicalization. We've gotten into understanding trust and who CHWs are, but let's talk a little bit about policy and sustainable financing and funding. One question came from our audience member, Samantha, who asked, what are some of the barriers to adequate CHW reimbursement? Who would like to take that question on?
I was just typing the answer, so I'll save myself some time here. Yeah, the first barrier is state policy. I think it goes state by state. Some states have reimbursement policies. I know California recently, a couple of years ago, has adopted a CHW benefit policy that provides reimbursement for Medi-Cal or Medicaid patients. But I think there's also just the paperwork of it, for CBOs and even healthcare institutions to now get reimbursed for this new workforce. It's a first time for many, and then I think the final I want to point out three barriers. The final barrier is having the documentation done and losing the CHW to that documentation process, right? Instead of really focusing on their strengths, which is building those relationships, like Alex had mentioned, being out in the community, not losing the community in CHW, like Janae mentioned as well, and minimizing the amount of time that is spent on that documentation, which is really necessary for reimbursement. So reimbursement can be a double-edged sword, right? It does provide some funding. A lot of times it's not really adequate to support the amount of time that a CHW spends, and it reduces you to that 30-minute window, and then people all of a sudden are saying, well, let's not send them out into the community anymore. They're much better. It's more efficient to keep them on a phone or on a computer. So I think those are some of the challenges that come with reimbursement.
Fair.
I can.
Everybody's jumping in here now.
Go ahead.
Alex.
You're gonna go? Okay. I think the other piece is about limitation of the scope of services. So, okay, you are getting paid or reimbursed to do ABC, but what about if the CHW find out that the family needs D and F? They will stay with no pay. They will help the family. So I think reimbursement needs to be challenged too in the way of doing things, because sometimes they pay for 30 minutes or 1 hour, and the CHW will end up supporting the family for 3 hours. And that's a gap of funding that the agency is really committed to pay because they deserve to get paid. So I think that's the other challenge that we have to. And the other piece that I want to mention as a community-based organization is this dream of getting reimbursed to CHWs is a dream, or is becoming a nightmare? Because this dream can become a nightmare. Okay, nice, we have funding, but now it's becoming a nightmare. It's not really helping. It's really taking away the CHW from the community. We're becoming more extenders of a clinic or of healthcare service. And we should be knowing not as an extender, but really as a community, a member there. So I think it's important. Yeah.
Can you just for those in the audience who don't quite understand the difference between sort of the worker and the extender, can you speak a little bit to what does that mean, a community health extender?
Yeah, sometimes I'm talking about the as a CBO, as a community-based organization who work with clinics and represent the CHW workforce in many areas, working or trying to integrate this model into healthcare sometimes creates some confusion. And one of them is the CHW an extender of a healthcare, or really a representative of the community? Who I'm representing? So I think that was kind of the difference between both.
And incredibly important to this topic, right? That we want to maintain that people are able, community health workers are able to be sort of owned and part of the community, as opposed to owned and part of the healthcare system, an extension of the healthcare system. They are really an extension of the community, a really important point. So thank you for that. I wanted to get back to this policy and sustainable funding question. And instead of talking about barriers, which I think is really important to understand what are the barriers. I always like to look at the bright spots. So I'd love to hear from all of you or any of you about what you think innovative funding models, what innovative funding models have you seen that successfully sustain CHW programs, and how might we be able to expand them? Juan Carlos, I'd like to start with you and then maybe go to Sigrid for this.
Yeah, I'll just use our example. We started with community benefit funding. So we approached the CHW integration into our healthcare system as a workforce development approach and strategy. So only full-time positions, fully benefited, and funded to kind of do a proof of concept, funded by our community benefit dollars from the hospital. I think grants have come because we've shown that it works. And I think grants are wonderful as an addition, but not really replacing FTEs that are committed. I think reimbursement is another piece of that sustainability strategy. But then finally, we're looking at models where the hospital actually dedicates budget like it does for other positions, because of the value that CHWs bring to the hospital. So I think that's kind of the future, and not always being limited by reimbursement limitations or grant funding that should be just icing on the cake. It shouldn't be what we depend on, but really having the system commit to budget.
And in this case, what you're speaking of is the hospital system actually driving the reimbursement or the funding of the community health worker, as opposed to, say, a payer or a public insurer. That's well understood. Thank you. Sigrid, did you want to add to that?
I think the point of having the healthcare system contribute to the funds allocated to CHWs is really crucial, right? There's a lot of providers in the healthcare system that don't independently bill, but we fund them because they're necessary. And that is same with CHWs. So the challenge with having CHWs do billing, right, whether it's a time-based billing or billing for specific services provided, is, at least what we have currently, it doesn't cover the amount of time really needed for a CHW to do their work completely. And just like it has affected all of us as physicians when we're with patients, everything's in a rush, right? Because we're trying to, get enough patients seen, and all within a 15-minute time period or a 30-minute time period, depending on if it's established or new patient. So the health insurance companies really limit what we're able to provide. And I would worry that if it's only billing based, that the CHWs, again, are not going to have the full time available to spend with their clients and patients. But again, having some role for reimbursement by healthcare systems, having some funds always allocated for CHWs, and then grants on top are good. But again, inconsistent funding. So it should just be the very last piece of it.
It's interesting. Someone in our audience Phyllis talked about the fact that she's based in Kentucky, and that grant funding to keep CHWs actually ended in 2023. And she said her health department employer chose to allocate budget funding to keep her on staff. But the Kentucky Department of Public Health oversees the Kentucky Office of Community Health Workers and provides adequate training at various levels. And across the Commonwealth, as far as a few weeks ago, there were approximately 420 certified CHWs providing services. And what she's noting is that she does bill Medicaid when making contact with her clients in 30-minute segments. So there is this mix of funding, it sounds like, to reimburse for the services that community health workers are offering. I wanted to ask Janae or Alton, given the nature, and this is from Michael, of mobile community-based nature of CHWs, how might you determine the non-payroll costs of the position? I thought that was a really interesting and important question. Janae or Alton, might you want to take that?
Yeah, Alton, I'm curious what you think, if I miss anything, but community health workers, for example, that are really, remember, we're going to keep the community in the word when we integrate. That means they need to drive, they need travel expenses, they need to be able to, in our world and impact, we like a budget to do something positive for the individual. We call that a joy bubble, where it could be buying them a planner or something simple that makes them know that that community health worker is listening to them and wants to help them in a manner that's just not transactional. So I think there are things that you need to consider that they do. Like I said, travel, providing support to community health workers to do things for clients. Alton, what else do you think in addition to those things am I missing? Oh, workforce and professional development time and support, right? Like give them some money to grow and do better in their own manner. And I think they'll be able to be retained better than you would without it.
Yeah, I like the just I want to add, mental health is really huge. I think that as you're dealing with other people's issues, you really want to allocate time and finances towards doing something that can get your mind away or get you into a better headspace. Because dealing with a lot of it, you wear a lot on your shoulders, and you become a part of someone's life. Their problems become yours. Um, I think that team building is very important, and that could be with the immediate team of the community health workers, but also with the hospital organization, the healthcare system. I think that that's really important. Doing things, periodically. It's summertime, getting ready to come up. Do something where as though everyone just gets together, laughs. Sometimes it's not even always financial. Sometimes it's just having joy, having happiness. Those things can lift the spirit and be a good driver for going back and doing the job.
Alton, I can't speak enough to my support of that point, that we often talk about the detriment and the deprivation of communities. We very rarely talk about the joy and what we can actually bring into communities that really brings a better headspace, both mentally, physically, socially, and emotionally. So I really appreciate that point, Alton. I want to just ask one more, so just to round out these sets of questions about how we're actually funding community health workers. Sigrid, Janae, or others, could you just tell us, how do we make the case for CHW funding to policymakers who are unfamiliar with the value? Like, can you just give us a sense of what would the case be that you could make? And I'll start with
Taylor Clark. I feel like the case has already been made, right? Like community health workers are magical. One of the things that I think about, and I'll just speak to the experience of impact, has been over 16 years where we have demonstrated, like, if you give them the infrastructure that they need, if you keep them in the community, if you hire the right authentic people and give them a model that supports their person-centered approach, the return on the investment speaks for itself. Our model has demonstrated that healthcare, if you give us $1, we'll show you that we can give you 2.5 on top of that, because the community health workers are getting to the root. They're getting to the basics, and they're helping people navigate the healthcare system better. We see a reduction in inpatient visits, in ED visits, and all of that. So to me, the case has already been made. People just need to read about it.
And I love that. I love that point. And Sigrid, I'll just get right to you. But the every dollar spent, we're getting $2.50 back. And that's in a number of outcomes and preventative opportunities, like preventing inpatient visits and unnecessary ED visits, allowing patients to navigate the system, all the things that you said. I'm reiterating because I want to make sure that our audience is writing this down feverishly as they think about going to those policymakers and getting more funding for them. Sigrid, please go ahead.
Yeah, I think it requires.
Go ahead.
I think it requires a shift in how we view, healthcare and health. That it's not only what we provide within the four walls of the hospital and the clinics, but that it really most of the healthcare is outside of those walls, right? In the community, where our CHWs are able to have a huge impact. And I would love to say we need more data, but as was mentioned, we have data. There is data documenting how beneficial CHWs are in improving the health of our community. And now what it comes to is as was said, the policymakers need to hear about it from us. And we also need the insurance companies to be more involved in this process. This is money saving for them. If they are able to reduce ED visits or hospitalizations because of the work that CHWs are able to do in the community in improving health, in preventing illness, and preventing injuries, that is not only a good thing for the individual in the community, but can make a case for the insurance companies as well. So something that really all of us need to get behind and support.
100% agree. When you think about the various players in the healthcare delivery system, payers are those are unique in that they are really meant to be covering a geographic location as opposed to just their patient population or just the beneficiary population. Oftentimes hospitals are the same. They have to bring in folks from the community where they're not necessarily covered. So really being able to have that cover, being able to bring in resources that can help those people and patients be better served is going to be so very important. I'd like to now move to sort of solutions from the field. So I'd love to start with you, Alton, on this question. I'm wondering if you can share with us a success story of a CHW-led initiative that overcame funding or structural barriers, and maybe what you might have learned from that. If you can help us with that, and then Janae, maybe you could also speak to that.
Oh, wow. Thank you. There's so many stories. It's hard for me to just choose one. It truly is. I'll speak about someone who I was recently working with. Her name was Sharita. She is actually an author, which is interestingly enough, and I didn't find that out until later, but going through some physical ailments right now, mental health ailments as well. She suffers from bipolar disorder, and she's been struggling to find ways in order for her to find her voice. As mentioned, we talked about just overcoming what does it mean to find your voice? What does that look like for you? Some of the activities that we did was just journaling, just talking about, hey, who am I? Where am I at now? Going back to her childhood, listening to what she had to say about what that was like growing up with her parents, her family, and being able to connect with her throughout community and through the church, actually, which was really, really big. Whereas though she found out, she had a great relationship with God, and that's where it kind of started at. But she lost that on her way. In addition to being able to find her voice, it seemed as if society kind of clouded that, kind of pushed it out of her, and she was able to reroute herself simply by us spending time in the Word, spending time with journaling, and looking for opportunities to get her voice heard out into the public, and which she has done. She was actually just recognized at it's a national mental health forum or alliance that they have here in Baltimore. And when she did that, it was mind blowing. I didn't expect it to go as well. She came up there, she was awarded. And I think that she began to find pieces of herself in the middle of that. And all I did was just enable it. That's it. I just empowered her to step into that change.
I love that. Just when one individual CHW can do for the people and patients that we serve is so very important. Does anyone else want to share a success story of a CHW-led initiative that overcame funding or structural? Yes, please go ahead, Alex.
Yeah, I think this is something for. I think we have to change the way we fund CHW programs, and I think we need to get multi-sectoral funding. And we are leading an initiative in Los Angeles where we have county departments, managed care plans, and we are start getting kind of analyzing how we can diversify funding to get paid for success models for CHWs. So it's not depending of a grant, but it's depending on what they provide to the community. So for example, if they are doing home visit for diabetes, okay, we have this funding source for the public health department. But they did a referral for community supports. Oh, we have funding from the managed care plans. Oh, and they did. So I think we have to change the way of, and we need to challenge our systems and have a multi-sectoral funding approach will be solving, including the philanthropic funds. So we're getting philanthropic people on the table. We have managed care plans, county departments, state, to start creating new models of funding. So I just want to give, it takes time, but I think that will be our one solution to try to sustain this workforce beyond of a grant or beyond of one funding source.
Very, very wonderful. Thank you, Alex. I'm going to actually ask each of the panelists now, before I go over to the audience Q&A, to answer one question about if you could change one thing about how CHWs are supported. If you could change one thing about how CHWs are supported, what would it be? And I am going to start with Sigrid, and I'm going to work my way around based on what I can see on my screen. Go ahead, Sigrid.
Yeah. I think the CHWs need acknowledgement, both in the healthcare system by healthcare providers, that of the really important work that they do, and the extension of the healthcare system as an ability to continue supporting patients and improve their health. So just really that acknowledgement and the respect.
Understood. Thank you, Sigrid. How about Juan Carlos?
Yeah, I think my response is along those lines. The recognition that lived experiences are as valuable, more many times, than any kind of formal training that we have. I mean, there's just no way we could do the work that we do with our community health workers without them. Healthcare cannot solve community issues without involving community.
Fantastic. Thank you, Juan Carlos. Janae?
There are many things, so one is hard for me, but I think at the top of my list is to pay them well. I think the average CHW salary across the nation is dismal, maybe $36,000, $37,000. And as we just talked about, their demonstrated return is worth more than that. So I'd love to see across the nation average CHW salary being, plus benefits, being, $55K plus. Pay them because they're worth it.
Wonderful. Thank you, Janae. How about you, Alton?
Yeah, I'll echo both. Of course, like the pay and the benefits, but it's also the recognition. I think that for myself as a community health worker, what I'm more have to be, what has to really be understood is this is organic. It's from the heart. It's love. It doesn't have really a price on it. I do it because I really care about these people and I represent them well. So just being able for someone to say, hey, thanks. I really appreciate that. But that being given financially as well, yeah, that stands the test of time and will be great.
Wonderful. Thank you. And Alex?
Yeah, I love, and I agree with all of the other people to say. I would like to maybe thinking about shifting funding from temporary grants to permanent multi-sector investment. Healthcare, housing, social services, philanthropic, that all of them, they should be contribute to the CHW salaries.
Wonderful. So here's what I've just heard. There's a lot here. First, acknowledgement as an extension, not just of the health system, but of the community, which was something that we have reiterated here today. That when callers noted a recognition that the lived experience is as important as any training anyone can get. I appreciated Janae, you putting it right out there that we need to pay them better with benefits as well as pay, because we really need to reflect the value that they have. Again, $1 spent, $2.50 return. And that's really not been reflected yet in how they're getting reimbursed. And so that's really important. And then finally, shifting from the funding, from grants, just grants. I really appreciated this, Alex, when you're talking about permanent multi-sector funding. This is going to be ever so important as we really think about whole person care, and not just implicating a healthcare delivery system, but implicating many other sectors of a community that allow people to thrive. And so it's going to be ever more important that we bring sometimes what we call strange bedfellows together to really be advancing the work that community health workers are so incredibly embedded in and important to. So I wanted to now, do we have any closing Q&A, John, either of the Johns? Do we have any other questions from the audience? And if not, I'm going to actually turn to our closing poll.
Looks like just one question came up, which is how will the new administration impact the role of the CHWs?
Okay. Fun question. Anyone want to take?
I'll start, and I'll take a deep breath.
Yes, please.
We've seen across the nation CHWs losing their jobs, programs being defunded. So unfortunately, we're seeing the impact of community health workers being that they're being stripped from communities that have experienced inequities for one reason or the other. We see a lot of community health worker programs trying to pivot and rebrand themselves, but the source of funding for many community health workers have been equity-ish related grants. So I think we're already seeing the effects of the administration, and I pray it does not continue.
Thank you, Janae. Anyone else have thoughts about that? Okay.
I was just going to add, when we look at what the administration is working on, and unfortunately in defunding a lot of really important programs, especially for higher risk populations that are at risk for not just violence in their community, but all the chronic illnesses that go along with it. One way that I think we can try and address this is by rephrasing certain things, by looking at chronic medical conditions, mental health conditions, substance use as a way to support those, because those are the things, again, that our communities are struggling with, right? Especially if there's ongoing job losses, things like that. So it may require some rephrasing in order to continue to get funding from, Medi-Cal, Medicare, or grant programs as well.
Thank you.
And I just want to add, if there's such a focus on cost savings, community health workers are the best ROI for healthcare, right? They're much more than that, and I hate to just limit their role to cost savings. I would just add they can also help with healthcare provider burnout, because a lot of providers are not trained to address social drivers. That's not what you go to med school for. So it requires a team approach, and our community health workers can really help save some folks who might be thinking of switching professions, and I've seen it.
I think that's an incredibly important point that you bring up, Juan Carlos, that frankly, there's burnout everywhere, even probably among CHWs, we can be sure. However, we do know that the primary care system, even specialty care and nursing care, is really burdened with burnout. And the question becomes, what are we going to do to implicate the system in terms of these social determinants, and having a community health worker or having others that can really help to drive better outcomes for people and patients that they serve is going to be so important. Alton, I see that you're off of mute.
The whole idea is change, essentially. And it has to start at a granular level. It has to start at the base of everything. And so, again, putting that forefront about these communicable diseases to non-communicable diseases, and looking at that and saying, hey, there is potential for change. Well, not potential, but these things will change. And using the results they speak for themselves, and just continue to place that at their feet.
Wonderful. Yep. Thank you, Elton. So we've got about 5 minutes left, and I'm going to ask for final remarks from our esteemed panelists. And as they share their closing thoughts, we're going to invite you all in the audience to complete our closing poll, which will help us assess your learning from today's discussion. This is actually the same question from our opening poll. And the question is, how would you rate your understanding of the role and impact of community health workers? Do you feel that you've learned more? For those experts and those who are strong, maybe you've learned something different, which we can't actually capture here. But certainly for those who had limited basic or moderate knowledge, do you feel that you've learned a bit more about community health workers from this past hour? And what I'll do while you all are answering those questions is I will start with our panelists, and I'll ask you if there were one thing that you want our participants today to walk away with about their understanding of community health workers and the role of community health workers, what would that be? And Alton, as a community health worker, I'd like to start with you first.
It's only fair. We love one another. And what I mean by that is for the communities that we serve, for those that we are able to partner up with in this fight, we love one another. And that's the essential quality to walk away with.
Thank you, Alton. Thank you. Sigrid.
I'd say, the benefits of CHWs are just so long to list out. And if you don't have one in your healthcare system, try to figure out how to get some, because it's going to be a remarkable improvement in the care that patients receive. And as Dr. Balliard mentioned, the support that's given to the healthcare providers themselves as well.
Wonderful. Thank you, Sigrid. Janae.
I think I'll just leave you guys with saying that community health workers are not healthcare workers. They are of communities, for communities, and best at helping communities. They are extensions and extenders of the healthcare workforce, but they should be considered separate, distinct extensions of it.
Wonderful. Yes, a really good point to reiterate that this is not a medical extension. This is a community extension, and it starts, begins, and ends in and for and from the community. So thank you for that, Janae. Alex.
I will say that this workforce is really the heartbeat of our communities. And administrations may change, funding structure will change, but the need and the role of the CHWs in our communities will never disappear. So we need to co-develop, co-create new things, but we will stay in the community always.
Absolutely. Thank you, Alex. And Juan Carlos, you have the last word here.
Yeah, for me, it's what community health workers and promotores have done for me and for the system that I work in, right? And that is break down those us and them barriers, right? And to get us closer to that beloved community that Dr. King kind of gave us a vision for. And especially in times like this, I think it's so important to break down those we-they barriers and really work for the greater good. And that's what CHWs do for us and our systems.
100%. That was a beautiful ending. We appreciate all of your insights. Thank you to our panelists for sharing their expertise and to our audience for your engagement. Thank you to everyone who participated also in the poll. It looks like we have no one who has a limited knowledge anymore, John. So we've moved folks up, and we're grateful for that. It's helpful to see these insights as we wrap up, and it's also helpful to know that you all are here on the front lines doing the work. So thank you very much for being here, and I'll turn it now over to Mr. Clymer.
Well, thank you, Dr. Taylor Clark. Thanks to everyone in the audience for joining us today and engaging in this critical conversation about the role of community health workers in improving health outcomes and strengthening our health system. I'm so excited about the energy that is so palpable in the chat and the really high quality discussions or contributions that you've made to this conversation. Your participation underscores the growing recognition of community health workers as essential members of community health force. Your chat contributions added a ton of value, so thank you. A recording of today's briefing, along with related resources, will be available on the National Forum website, www.national.nationalforum.org. We encourage you to revisit the discussion and share it with colleagues who could not join today, and continue exploring ways to support CHWs in your communities. Please also keep an eye out for future briefings. If there are topics you'd like us to address, we welcome your suggestions. How can you take what you've learned today and put it into action? An immediate way to do that is by becoming a signatory to the joint policy statement to expand access to CHW services. The Value and Access Collaborative crafted this set of policy recommendations to advance sustainable funding, workforce development, and full integration of CHWs into the health system. A link to review the statement is available in the chat. To add your organization as a signatory, please reach out to us at the emails provided in the chat. Now, we value your feedback. Not just your input, but your feedback as well. Please take a moment to complete a brief survey about today's event. The link for that is also in the chat, and it will be emailed to you shortly. Finally, on behalf of the National Forum's Value and Access Collaborative, I want to thank our sponsors, express my gratitude for your support to Ardelyx, BMS Pfizer Alliance, Novartis, and Regeneron, whose support makes this briefing possible. And of course, a special thank you to our incredible panelists for sharing your expertise and perspectives today. Alton Boulware, Sigrid Burris, Janae Tyus, Alex Fajardo, JC Belliard, and our fabulous leader, Kaylon Taylor-Clark. Thank you again. We look forward to continuing this important work together.